In this episode, we'll be discussing a landmark paper titled Oral Sildenafil in the Treatment of Erectile Dysfunction. This paper originally appeared in the New England Journal of Medicine in 1998. To set the stage, at the time of publication, there were no available oral therapies for erectile dysfunction, and they wanted to ask, in men with ED, how do different doses of oral sildenafil compare to placebo? The study was funded by Pfizer and took place in 37 medical centers across the United States. Those included men ages 18 and older with a clinical diagnosis of ED, either of organic, psychogenic, or mixed etiologies. Men were excluded if they had other penile disorders such as Peyronie's disease, premature ejaculation, spinal cord injury, or other serious medical comorbidities such as poorly controlled diabetes. The study was broken up into two arms, a dose-response arm and a flexible dose escalation arm. Arm 1 was a double-blind, placebo-controlled fixed-dose study. 532 men were randomly assigned either 25, 50, 100 milligrams of sildenafil or placebo. Each man then completed the International Index of Erectile Function at 0, 12, and 24 weeks, and also was just asked about the general global efficacy of the drugs at 12 and 24 weeks. In the second arm, 329 men were randomly assigned to receive 50 milligrams of sildenafil or placebo. However, at follow-up, the dose could be doubled or even reduced by 50%. Like the first group, men completed the IIEF at 0 and 12 weeks and were asked about global efficacy at 12 weeks. The primary outcome was the mean score for questions related to frequency of penetration and the ability to maintain an erection after penetration from the IIEF. Secondary outcomes were looking at the global efficacy as a yes or no response to the question, did the treatment improve your erections, as well as looking at adverse events. When we look at the baseline characteristics of the men in the study, within the groups, they were quite similar. However, between groups, there were some small differences. The first difference is the mean duration of erectile dysfunction, which was slightly longer in the dose escalation group. And when we look at the degree of men with organic erectile dysfunction, there's a slightly higher proportion in the dose response group. Next, we are going to look at the mean scores in response to question 3, the question about frequency of penetration, which asks, when you attempted sexual intercourse, how often were you able to penetrate your partner? When we look at the percent change from baseline in IIEF score, with a higher score denoting a better outcome, we can see that the sildenafil group outperforms placebo, and it also seems to do it in a dose-dependent manner, with the biggest change seen in the 100 milligram group. In the dose escalation group, we see a similar dramatic improvement with sildenafil in all groups except for men with a mixed cause for their ED. Question 4 asks about maintenance of erections, asking, during sexual intercourse, how often were you able to maintain your erection after you had penetrated your partner? As with question 3, we see that sildenafil outperforms placebo at all doses, and even in the dose escalation group, we see for all etiologies of ED a significant improvement. This graph summarizes nicely the dramatic difference in the sildenafil group and their ability to have successful attempts at sexual intercourse. The authors noted that headache was the most common of the side effects, with flushing, dyspepsia, rhinitis, and visual disturbances following. Limitations of the study include that participants were instructed not to consume more than 2 alcoholic drinks within 1 hour of sexual activity, which may reduce some of its generalizability. Other critiques include its small sample size and its short follow-up and its ability to comment on the safety profile of sildenafil. Overall, this study established that sildenafil was an effective, reasonably well-tolerated treatment for men with ED of varying etiologies. It substantially improves erectile function and success rates of intercourse, with effectiveness maintained for at least 6 months. Although adverse effects were relatively frequent, they were usually transient in nature. That's it for this discussion. Thanks for watching.